Assalamu alaikum. Good morning, everyone. We have started a series of short talks about case studies. Today I'm going to discuss about Yolk Sac. Yolk Sac is a rounded structure seen in early pregnancy. When it's normal, its size is from 2 to 6 millimeters. In some of the literature, it is 1.9 to 5.6 millimeters. It functions as an absorptive epithelium for nutrient uptake and secretion, as well as the origin of the first blood cells. In human and non-human primates, the allantois is a small diverticulum which is part of the umbilical cord, connects to the bladder and acts as temporary store for fetal excretions. If we look at this diagram, we can see this is the yolk sac, and we have got the yolk nutrients inside. This is allantois. Then we have the albumin. Here is chorionic membrane, the amnion with amniotic fluid. Here is the chorionic fluid. Then is the embryo, and outside is the shell. So after looking at it, it comes to our mind that what is the appearance of it and how it works. We need to know that it is surrounding the embryo, and it looks like a small white circle. The yolk sac nourishes the embryo and also helps produce blood cells. The yolk sac is surrounded by a large area known as gestational sac, this one which is shell-like structure. Here is the allantois, amnion and yolk sac. It is the extra embryonic membrane to appear. The chorion also develops from yolk sac and functions to nourish the developing embryo. It also produces chorionic fluid, which is essential for cushioning and protecting the embryo, whereas the allantois is a sac-like structure, which is extra embryonic membrane. Here it is extra embryonic that removes waste from the embryo. The allantois exchanges oxygen and carbon dioxide with the air outside the eggshell and serves as disposal site of uric acid. The yolk sac is the extra embryonic membrane that surrounds the egg yolk. Here it is, a yolk sac. This is the yolk sac, the embryonic heart and amnion. Then another question arises that can there be a yolk sac and no baby? The answer is that it contains a yolk sac protruding from its lower part, but no embryo, even after scanning across all planes of the gestational sac, thus being diagnostic of an anembryonic gestation. A blighted ovum is a pregnancy in which the embryo never develops or develops and is reabsorbed. Here is our interesting case. We can see how by TVS the yolk sac appears. This is a gestational sac, and we can see a small rounded area which is inside. Here it is not properly visible, and this look to be larger. This was a case of a female 34 years old, gestational age of 8 weeks. Patient had vaginal bleeding, and here you can see the gestational sac is having no yolk sac. So absence of yolk sac, any yolk sac which is smaller or too large is a problem. In some of the studies, having a yolk sac that is too large or too small has been associated with pregnancy loss. However, abnormal sac size occurs in approximately 17% of pregnancies. But keep in mind, in many cases, women go on to have normal pregnancies even if the yolk sac is slightly smaller or is slightly larger. This was all about the yolk sac. Thank you very much.